Hi, I'm Socrates Angelides, and this is part 3 in a series assessing or discussing the issue of preservatives in the cause of diabetes. In this particular clip, I will focus on type 1 diabetics, particularly as there have been some misinterpretations and misunderstandings of some of the comments I've made on previous clips. So in order to fully appreciate the comments made in this clip, please refer to part 1 and part 2 of this series, as well as the clip Preservatives and Disease, an overview. Now, as with so many other conditions, there's been a gradual rise in the incidence of type 1 diabetics over the last 40 years. And this appears to be linked, from my research, to the amount of preservatives in one's diet. Having convinced myself of this link, and having seen the benefits that type 2 diabetics and other patients have obtained by removing preservatives from their diet, I sought the assistance of 2 type 1 diabetics. The first of these patients is a 16-year-old female who has been a diabetic for in excess of 10 years. She has been on a preservative-free diet for the last 3 years, intermittently. The other patient, however, was only diagnosed with diabetes 12 months ago, and it could be argued that she is still in her honeymoon period. She has been on the preservative-free diet for the last 8 months. What has become apparent from both these patients, however, is that their blood sugar control has improved, as is their hemoglobin A1C levels. Furthermore, when these patients are exposed to preservatives, this control is lost. And in the case of BSLs, this may last for 1, 2, or even 3 weeks. So even a small amount of preservatives can return patients to a worse state. Furthermore, the amount of insulin that both these type 1 diabetics require has been estimated to be less than 50% of other diabetics of a similar age and or duration of illness when we assess that in terms of insulin per kilogram of body weight. The other benefits that patient A has noticed have also been very interesting. She has noticed that by avoiding preservatives, she has more energy, she sleeps better, she has less mood swings, she has fewer headaches, better concentration and attention span, less muscle aches, less fatigue, less bloating, and better bowel movement. These benefits, however, also quickly disappear when she is exposed to preservatives. Furthermore, she can also recognize within minutes to a few hours that she has inadvertently ingested these chemicals, as adverse effects, including headaches and abdominal bloating, will occur. Finally, the benefits come slowly and often only after 3 to 6 months of strict preservative-free diet intake. And as I've already said, a small amount of preservatives can undo these benefits, and often for weeks, even months at a time. So it is important that one is careful in what they eat and is determined to succeed, as it is not easy. The exact mechanism by which all this happens obviously remains unclear at this stage. But what is obvious from these patients and from type 2 diabetics is that the BSL, the blood sugar levels tend to gradually fall the longer you stay on a preservative-free diet. As a result, in order to avoid hypoglycemic attacks, or hypos as they're commonly known, lower doses of insulin in the case of type 1 diabetics, and in the case of type 2 diabetics, lower insulin and or tablet doses are necessary to maintain the blood sugar levels within the normal range. So remember, if you do decide to go on this diet, you only change your insulin levels according to your blood sugar levels, as you should be already doing at present. Now, to avoid misinterpretation or misunderstanding of anything that I may have said, it is very important that you let your doctor know before you start on this diet. Another point that needs to be made is the patient A also suffers from celiac disease. Oddly enough, her antibody levels have remained undetectable despite regular small amounts of gluten exposure, usually in the amount of a tablespoon of bread most weeks of the year. Now, whilst this may be a coincidental finding, it does raise the obvious question: is celiac disease also a manifestation of excess preservative intake? Thus, all this information, all this data is very fascinating and demonstrates that just like type 2 diabetics, type 1 diabetics, at least some of them, can improve their symptoms and can improve the diabetic control by simply eliminating preservatives from the diet. Furthermore, a cure cannot be discarded as a possible final outcome of this finding, and therefore we need more research to explore this issue further without building up expectations unnecessarily. Finally, other autoimmune diseases may also benefit from this observation. So we need to do more research, and we must not be deterred by negative comments. Now, I'm aware that each of these clips raises questions, ideas, skepticisms, and misunderstandings. Remember, I'm trying to grow awareness of the potential impact of preservatives, and hopefully this will lead to more research. At present, my studies appear to be the only formal investigations undertaken to this area. Now, there are several websites which do provide useful information, and this is often invaluable and a great inspiration, but it is anecdotal, and we need more formal studies into this area. Now, this clip, as I've already alluded to, is concentrated primarily on type 1 diabetics. And remember, it is impractical to squeeze all the knowledge that I have on this topic into a 5 or 10 minute clip. This can only be achieved with a 4-hour segment, and this is an obvious difficulty. So remember, as to avoid unnecessary misunderstandings, please do not stop your medications. Please seek medical advice for your specific circumstances, and please remain under frequent medical supervision. So if any unnecessary misunderstandings do arise, these can be addressed promptly and effectively.